Hello everyone, welcome to today's session. And today we are going to talk about low milk supply. We are going to talk about all the questions that you guys have. We have already received a lot of questions. If you all are having any questions on this particular topic, please do drop them in the questions box below. And we will be having with us a lactation expert of your question. So let me just get her in.
Hey,
Hi, Vivi.
hi, hello.
Hi, I'm just
I
waiting
think,
for Aline to join.
yeah. I saw her. She has already joined the live.
Okay.
Yes, we have so many questions.
Yeah, maybe you can give a brief introduction by
Yeah,
the time Aline joins.
yes. Today we are going to be having lactation professional Aline with us, and we actually Aline was the first one to take us live on Insta Live. Nilufar and I were live with Aline for the first time on Instagram, and that's how our journey started. She also supports a lot of mothers via Instagram DM. Unless and until any consultation is needed, she does not prescribe them for that. So she is all the time available to answer your queries even via her Instagram handle. She's also supporting new mothers by conducting many free sessions so that.
Hey, hi,
Hi
Aline.
Eileen.
Hi,
So lovely
So
just
to
a
have
happy.
minute.
Huh?
you here. We already have given a brief introduction about you, and thank you so
Okay,
much for joining us again today. We have a
thank
lot of
you, thank
questions
you.
already. Yeah, and the
Yeah.
Oh,
questions are still pouring in. So, Vidya, let's
Yes.
start with the questions. Maybe you
Yes,
can
yes,
start.
definitely.
sure,
Uh,
sure, sure. Am I
just
audible?
yes.
Perfectly.
And just before starting, can you just tell low milk supply? Does it happen? Just maybe 2, 3 lines, and we have many questions. Just
Hmm.
like an introduction. Yeah.
Yeah, so basically, if you say the word low milk supply, so I have already conveyed this earlier on the platform itself that it is a myth according to me. Unless it is something which is not diagnosed, I will not tell that the mother is actually, having a low milk supply issue. But because of the different tendencies that, different practices that are established with respect to breastfeeding,
Mm,
because of the beliefs that exist currently already, and because of lack of knowledge, obviously, on the part of the mother
mm.
and the people surrounding her, the mother is made to believe, or she just believes that she has low supply. So, like 90 to 95% of the time, that's the case.
Okay.
So that is why I'm saying associating this with the word myth. Okay, because most of the times it is something which can be easily overcome with some few changes in your, in the way you approach breastfeeding.
Okay, thank you, Eileen. Thank you
Yeah,
so much for that. And I'm not categorized these questions based on anything. We have got these questions. If you feel it is not part, it cannot be answered here, you can, tell that.
sure,
I
sure,
will ask all the questions. Okay.
sure.
So the first question is nipple pain when kid latches. How do I know when to switch the sides while feeding?
Okay, so these are two different questions in one actually. So nipple pain when the kid latches is indicative of shallow latch. It also depends on how long the nipple has been paining. Like, in the beginning when you just latch the baby onto the breast, little bit of mild pain is expected.
Hmm.
But if that pain continues for more than a minute, then definitely there are issues with your latch. Okay,
Oh,
coming to the second part of the question, which is regarding when you should switch the sides. So that depends on your baby, right? I mean, if your baby is, withdraws from the breast and still seems hungry, then you can switch the side. There's no particular timeline that, I feed on one side for 15 minutes, 20 minutes, and then I switch the side. It's nothing like that. Also, I also want to add one point here, which many mothers have this concern, ki should I feed on both breasts in one session? So that's not required. Okay, if your baby
Okay, okay.
is satisfied, then you can stop at one breast. That you have to just keep in mind at the next session that which breast had I offered in the previous session. That's all.
Okay, okay. Next is how to wean off formula. I'm expressing 2, but giving about 30 ml formula every alternate feed. Yeah. 2 months baby, I guess. 2 MO is written, so I'm assuming, yeah.
Yeah. So weaning of formula needs to be done very gradually. Okay. It is not something that you can just do cold turkey in one go. Okay. Please don't do this. People who are offering formula to your babies and you feel that okay, my breast milk supply is increasing, so let me just stop the formula and feed express milk. You cannot do that, and that is not something which any lactation professional will recommend to you. Okay.
Okay.
So depending on you and your baby's current situation, the weight gain, the pee poop, and other factors, they will come up with a plan in order to reduce the amount of formula step by step. So this is something, dear Mohma, which I cannot give a straight answer to this. You will have to get in touch with a lactation consultant for that.
Okay, okay.
But yeah,
And the
I
next,
can just say this much, that don't wean off altogether. You have to do it step by step.
right. And the next question is, I get only about 30 ml every time I express. Don't get time to. That's all the question is. So I don't, yeah.
Okay, so if you are getting 30 ml, it also depends on how often you have been pumping. So don't, if you're just randomly pumping once a while and you got 30 ml, that doesn't mean you are generating 30 ml all the time. Okay, I will trust your output is 30 ml if you tell me for a period of at least 3 days when you have been doing it every 3 hours that I'm getting 30 ml. Okay, so
No,
at least you should be pumping for 2-3 days continuously every 3 hours before you start judging how much your supply actually is.
right. And the next one is, my baby is 45 days old. While feeding, she only feeds for 5 or 10 minutes and sleeps. Is my milk sufficient?
Well, so that depends on the baby's pee and poop count. So your baby is 45 days old. So generally the standard practice is 6 individual pees in 24 hours and passing at least one stool regularly every day. Okay. If these two parameters are matched, then your baby is getting enough of breast milk from you. And if it is not, then definitely you need to get in touch with an LC to assess your supply.
Okay.
Yeah, guys, I just want to hold you guys in between. I see a lot of questions being posted in the comments. Everyone who's watching this live session, we cannot really answer your questions from the comments because we actually lose them. We do not have any system in Instagram where we can keep track of that. So please post your questions in the question box. You can see a question icon at the bottommost corner in your phone. So can you, please post your questions over there. Yeah, Vidya, please continue.
Yeah. Eileen, before going to the next question, again, a short answer from you
Yeah,
for this.
yeah.
Who determines that the mother's supply is low? Like, can she herself, say that, how she comes to this conclusion? Or should she even come to this conclusion that, her milk supply is low?
No, she shouldn't. So if at all she has an intuition, okay, so mother's intuition mostly is always right. Okay, so if she has an intuition, she should get in touch. First point should be an LC. Second point should be the gynecologist. Okay, so if the LC feels that there is a genuine milk supply issue, they will themselves probe you to go forward and get your. There are certain tests that are done, hormonal tests, which will actually tell you whether you have a low milk supply or not. But that is something which is like, the last point. As I told you, because our bodies are made to produce milk. So there is no way that there will not be milk, because milk is already being produced in 16 weeks of pregnancy.
Right.
So unless there is a genuine medical issue, or there is some obstruction, some maybe the physical anatomy of the breast or something like that, and that things can only be diagnosed by a medical professional, not by the mother herself. But yeah, if you have an intuition, then first LC, second gynec.
Thank you, Aline. Thank you. Can milk supply increase after 3 months of delivery? If so, how?
Yes, it can, of course, it can. So, if you, the best way is to just, get yourself in touch with a lactation professional. But to start with, I can tell you some quick tips here right now. What you can do is, hand express after every breastfeeding session. If you have already, now I'm assuming you have already got your baby is already breastfeeding a bit, and you feel that you have low supply and you're topping up with formula. This is the case I'm assuming. So you should hand express after every breastfeeding session. If you are not breastfeeding at all, you should consider investing in a pump and begin pumping every 3 hours. If that still doesn't help, then you should take professional help.
Right. And next question is, I'm having inverted nipple and using nipple shield for feeding. Will
Hmm.
that decrease my milk supply?
No, it won't decrease your milk supply. But one thing to consider here is that, for flat and inverted nipples, it's the same case. You cannot use the nipple shield for prolonged amount of time. Okay. In the initial phase, okay, though it is not like the best practice, but yeah, it helps. So I will not say that it is not helpful at all. But once your baby has got the hang of the nipple shield, it will be difficult for the baby to transition to the breast totally out of the nipple sheet. It's like weaning the baby out of the bottle to the breast. Somewhat the same thing. So we don't want the baby to get used to the nipple shield, and hence, if you ask me, I will suggest, like, in 1.5 months, you should try to get rid of the nipple shield. You can give one feed with the nipple shield, one without, one with, one without, and if you feel that nipples are inverted and no milk is coming, please don't think like that. Okay, because the baby is going to latch onto your breast and not onto your nipple, so the baby is going to get feed anyway.
And also one point to add, or you can maybe add to that, that it is not necessary the baby will immediately start feeding, right? Like it can sometimes the baby might refuse. It is
Yes,
not that, yeah. So it's a gradual process. So don't panic, or yeah, even if you panic, reach out, but don't think no only nipple shield will work, right?
exactly. Yes, yes. I'll add to this. Don't get discouraged, because see, whenever it is change is something. Even when we as adults go through change, we also go through a state of panic, right?
Right.
So you have to always put yourself in the baby's shoes and think, like, if this change were to happen to me, how would I react? And then you have to take the next step further. It's that simple. Okay. So it's like you're transitioning them. So definitely there is going to be a setback. There is going to be, like, a push. So don't think that, okay, नहीं जो चल रहा है उससे ही मैं चलाती हूँ. That's not going to help.
Yeah. And next is my 4 month 10 days baby drinks milk 5 to 7 minutes every time, but very active. Is this sufficient?
She said 5 to 7 minutes.
Yes, but
Yeah, it is
very active.
sufficient. Yeah, it is sufficient. Again, I will say, based on the pee and poop counts, which I mentioned some time ago. So that is the main parameter. See, the baby should be achieving their milestones, okay, like, the physical milestone. Other than that, the pee and poop. And, you just see that the baby is growing well, no much of issues. So then it's fine. And as they grow, their sucking capacity increases. So in 5 to 7 minutes, it's understandable that a baby's 4-month-old is completing their feed.
Right. Yeah. And yeah, now coming to the comment section. My
Okay.
baby is 4 months old. I get max 90 ml one side when pumping, and baby should get 120 ml diet. How should I increase my breast milk supply?
Uh, how old is the baby? Sorry, I missed.
Baby, no, no problem. My baby is 4 months old.
4
I
months.
get maximum of 90 ml one side when pumping, and baby should get 120 ml as per diet. How should I increase my breast milk supply?
Okay, so I am assuming that the baby is also on formula if you are just having 90 ml supply. Okay, so and I also would love to know if you are pumping every 3 hours and then telling me that you are getting 90 ml supply, because based on that only I will be able to tell something further. Okay,
Yes.
increasing breast milk supply is a very gradual process and a slow process which happens over a period of 1 2 months also.
Yeah.
Okay, so I cannot give a point blank statement here, but I can say this much that if you are giving a certain formula which is prescribed by a pediatrician and you're saying 120 ml should is diet means it's prescribed by the pediatrician, then right now you can offer that the remaining as top up. Okay,
Mm-hmm.
offer the 90 ml that you are getting in the output, and then on top of it you can give the formula milk 30 ml. Okay, and meanwhile get in touch with an LC and work on balancing the formula and breast milk or whatever your goals are. Okay, whether you want to shift back completely to breastfeeding or you want to have a balance of breastfeeding formula feeding as it works for you.
Okay.
Yeah, just
The next.
with you 1 second. We have a lot of questions actually in the questions box. Okay,
Okay.
Okay.
so let's
Yeah, yeah.
prioritize them. Another thing is, I don't think we will be able to answer all of them because I see around 45 questions.
Oh my God.
Oh my god.
Yeah, so
Let's
I
try. Let's try.
we will be able to answer all of them. So how do you guys want to take it?
Let's take yeah, maybe we can take no the recent ones. We'll see. Maybe it might
Let's
merge
let's
with some other questions.
yeah, yeah, even I feel the same, most of them may be repetitive, and if
See, maybe
we'll start from the top.
what I can do is we have this session for another 15 minutes or something, right?
Right.
So I will start asking the first come first, like the initial questions, not the recent ones. I'll start
Okay.
asking them. Let us reach
Okay.
to a point by 6 p.m. wherever we are. Remaining questions, I'll take screenshot and I will be sharing with you. And maybe you can post them with you later on,
Yes.
and you can answer them later on.
Done.
Okay,
All
Done.
that
Done.
sounds
right.
good.
Done.
Yes.
Done.
Yes.
Yeah.
Okay,
Yeah. Yeah.
thank you so much. Yeah. And just another time mentioning to everyone who's posting their questions in comments, those questions will be lost. We will actually not be able to recover them. If you have any questions, please post them in the questions box.
Yes.
You can actually see it at the bottom of your screen. Yeah, so I'll start with the question.
Yeah.
Yeah. Yeah. Okay. The first question is how to help 3-week-old baby latch correctly.
Hmm. Okay, this is a very generic question. I cannot answer this, but just will tell you that emphasize on positioning. See that you are positioned well when you are trying to latch the baby. Get the baby to you instead of taking your breast to the baby, and prop the baby with enough pillows and bring the baby to breast level. Now, this is just for now I can just tell you this much, but rest things I'll have to take your case history to give you further advice.
Okay. Yeah, I'm just moving on to the next question. Just a minute.
Because it
Okay.
depends on many things. If you're saying 3 week old to latch, I mean, currently is the baby on formula? It depends on that. It depends on what in the last 3 weeks, what all has happened.
Right.
Has the baby been introduced to the bottle? Is the baby feeding formula with vati spoon? Is the baby actually breastfeeding or not? Is the mother pumping? There are so many things.
Yeah.
So I'm really sorry if I'm not able to answer everything, but I'm trying my best.
Yeah. Yeah. Definitely.
Yeah, thank you so much for that, Aline. You have been like really helpful, by the way. Yeah, so the next
Right.
question is my baby sometimes feeds only for 15 minutes and then sleeps. He doesn't wake up or even take the breast. Uh,
Okay. How old is the baby?
no, she has not mentioned that.
Okay, so if this is an older baby, then it's fine. If the baby is less than 3 months, then I would expect that the mother is, if the baby is feeding on 15 minutes, it is okay, but the baby should wake up for the next feed at least, in 3 hours maximum. So if the baby is not waking up in 3 hours, I am expecting the mother is going to wake up the baby and feed. But if it's an older baby, it's fine.
Okay,
Hmm.
my next question, my 6 month old, she refused breastfeeding in daytime, but at night time she takes why this? Like, she's asking that she refuses the feeding in daytime, but she takes it in the night time.
Okay, so I'll give you a suggestion. You can try to mimic the night scenario during the day, just shut the curtains, off the lights, tell everybody to move out of the room, and try to feed her just like you feed her at night. Maybe if you're lying down and feeding her, maybe that's what works for her. So maybe do the same, mimic the entire thing in the morning, daytime, and then see, because babies are not going to know when it's day and night.
Yeah.
There is something different that is happening in the night which she's finding comfortable. So try to mimic it and you'll definitely see the difference.
Yeah,
Because
my
there's
next
no way that she breastfeed in the night and she's not breastfeeding in the day. That won't happen.
okay. Yeah, my next question is my 3 month is completely on formula. Will he face any problems in future compared to breastfed babies?
No, not not at all. See, so formula is recommended, as the next best food after breast milk for consumption for infants and babies. Okay, so I am not going to say that it will have any issues in future. Definitely, but when you compare breast milk and formula, definitely breast milk takes a precedence. Okay, so if you feel that you are not having enough milk and that is why you have switched to formula, your baby is 3 months old, you said, right? So you still can switch back to breastfeeding if you wish to. Okay, maybe you can get in touch with professionals, as I told earlier. Okay, they can chart out your entire plan and they can help you out. Maybe it will take a month or two, but you can still try to bounce back. Okay, and maybe we can try to have at least 60-40, if not 100%, 60-40 of breastfeeding and formula. Every drop counts. Okay, so don't be discouraged. I'll just tell you this much, that if you're currently your baby is feeding formula, don't feel guilty or don't feel bad about it, or don't be worried about his or her future. Okay, most of us are formula fed babies and we have grown up to be pretty fine, so look at the brighter side of it. Okay, the reason, now you will tell me that I am an advocate of breastfeeding. Why am I saying like that? Because the reason is that I am going to obviously promote breastfeeding more than formula, because formula is human made. It is made outside, and breast milk is something our body makes. So definitely that has more benefits. Okay, but when it comes to something in this world other than breast milk, which is recommended for babies to consume, it's not even water; it is formula. So don't worry. Okay, just don't worry and try your best. I'm sure you have tried, but definitely, take that step. Don't think 3 months are done, now I can never produce milk. Try and get in touch with someone, and I'm sure you'll get some solution. All the best.
Yeah. Thank you so much, Aline. Yeah, the next question is my baby is 2.5 months old and he feeds every 2 hours. I feel no heaviness in my breast just after 2 hours. I feel heaviness after 4 to 5 hours. Does it mean my milk supply is low? And in evening time, it happens more.
She said 2.5-month old, right?
Yes.
No, it's perfectly normal. It's fine. And
Yeah.
just one
I
point to
had the
add
same
here.
situation actually. It's perfectly
Yeah,
normal.
I
Yeah.
just that's what I just want to add one point here, that many mothers feel that if their breast is not heavy, they are not making enough. That is also a very big question mark in their head, and especially after 2.5, 3 months, the breasts don't feel as heavy as they were in the beginning.
Yeah.
Right.
So that makes them to feel that baby ka demand has increased and my breast milk supply is not sufficient.
Yeah.
So it's nothing like that. Okay, just feed the baby. The babies are not going to feed on an empty breast. Remember
Yeah.
that. As long as they're latching, there is milk.
Yeah.
Yes.
Yeah, the next question is how often to feed an 8-month-old who has 3 meals of solids in a day? She drinks much less than earlier. Is it fine or am I overfeeding the solids?
Yeah, you are overfeeding the solid. Okay. So at eight at 8 months, if you ask me, I will recommend only two solid meals, not three. You can jump to three solid meals at say 10 months. Okay, and make sure that whenever you are offering solids, you do it around 45 minutes after breastfeeding session.
Mm.
So if you complete your breastfeeding session say at 6 p.m. Okay, offer that solid meal at 6:30. 6:30 to 6:45 max. 6:45 तक offer कर दो. Don't think that baby is full and I'm not going to offer. Solid is just for taste purpose before 1 year of age. Okay, the primary nutritional source is only going to be breast milk, so try not to reduce breastfeeding sessions.
Yeah, the next question is I have cracked nipples since I have started feeding. Baby is 1 month. Tried sheet did not work. What is the solution as it pains a lot? I
Uh,
guess you already
like
answered this question, right?
Yeah.
yeah, likely that you have latching issues, so get in touch with a professional.
Yeah, because this is very particular. Yeah, the
Yeah.
next question is I have 2-month-old baby. My breast leaks sometimes and something it doesn't is okay. I didn't get this question. I have 2-month-old baby. My breast leaks sometimes. Will it affect my supply?
No. I mean, if your breast is leaking, it's good, na, that you're having adequate supply. Why will it affect your supply? Don't worry. It's normal for breast to leak in the initial postpartum phase.
Yeah, it's better to use some pads because you have some
Yeah,
pads. You can check
yeah,
on that and you can use that because it's a pretty common condition for most women and there's nothing to be worried about it as such. Yeah, the
definitely.
next question we have is nipple shield good for newborn baby if mother's nipples are inverted? So this question has already been answered initially. If you can watch the session again, you will get your answer. I'm moving on to the next one. Whether normal or C-section, is there really a food diet to be followed strictly as old ladies say? This is out of context. I'm so sorry, Sana. We will not be answering this over here because this session is all about breast milk supply. The next question that we have is what should I take in a day to increase the supply?
See, don't, there is no, particular food that you can swear by, okay? Because the breast milk, like I know that there are certain foods which definitely help spike up supply, but it also depends on how often you're trying to latch the baby. It can't happen that, you're not breastfeeding often and you're just eating in the hope कि मेरा supply बढ़ जाएगा. That's not going to happen. Okay, so the right approach to breastfeeding, the right positioning, and the technical aspect that combined with the diet is going to help. Okay,
Right.
so if assuming that your technical approach is right and you are able to latch your baby correctly, some of the top foods that I will recommend is eating lots of fermented food. Okay, daily have idli dosa in your diet. It should be there. Have methi. Okay, have dry fruits and stay well hydrated. If you are non-vegetarian, having one egg also every day is going to be helpful. Okay, but as I said, this depends on how well your latch is established. Okay, so
Right.
don't just go by this and sit. You have to work on your latch. That's the primary thing. And other than that, everything else in moderation. There is nothing that is going to help you just to increase supply.
Yes. Last
Yeah.
two questions, maybe. Last two.
Yeah, so the next question I have is my baby poops only 3 to 4 days. I guess it means once in 3 to 4 days since she is born. She is breastfed 99% and she is 3 months old. I didn't really
Okay.
get the question. I guess she wants to ask whether baby poops in whether it is okay for the baby to poop in once in 3 to 4 days.
Now the baby is 3 months old, right?
Yes.
Yes.
Okay. So actually, ideally, it is recommended for the baby to poop daily. Okay, at least in the first 3 months, we want that the baby. In fact, even later. But primarily, yes, we always suggest baby should poop daily. But if there are no other issues, okay, like she doesn't have any digestion problem, any constipation, gas problem, I would still recommend you, once just get this assessed by your pediatrician, because three,
Yeah,
four days is a long time.
this is
Okay.
important.
Yes.
Please
Yeah.
get
So
her
just,
by a pediatrician. That is really important. I
yeah,
think that's the best course of action to take.
yeah.
Yeah, the
Yeah.
next question we have is can't we continue using shield till end? This question has been answered by Aline. It's at the beginning of the session. Please watch it. Um, yeah. The next question is from 3 days, I feel supply has changed. Basically, supply has decreased because baby is getting too fussy at breast.
How old is the baby?
No, she has not mentioned that.
Okay, then it's difficult for me to answer.
Yeah.
But if the baby is going through a growth spurt, then maybe, yeah, the baby can get fussy. But in
Even
that
if
case,
the
you
supply
don't.
has not decreased, the baby can get
Yeah.
fussy.
Yes, right. So I would need to know the age, but yeah, suddenly in 3 days supply is not going to go down. So please continue latching and continue breastfeeding a bit.
Yeah. Maybe like, you can post more details about your baby's age in the comments once we post this video on our feed, and Aline should be able to answer you there. Okay, so I'm going to take my last question because we are already out of time. There are a lot of questions which are pending. As I said
I
that,
will
I'll be,
post it.
yeah,
Yeah.
yeah, I'll be sharing the screenshots with you. Okay, so the next question is I am giving both formula and breastfeeding, but want to give only breast milk. How can I increase the flow? I guess this question also has been answered by Aline
Yeah,
in the initial part of our live session. So just watch it again and you'll be getting your answer.
Yeah,
The
I
next question,
one second, Nilüfer. That question, no. Actually, I've got more details. She's one of our first 40 days mothers. So that question, I'll tell you, I'll add more details to that, Eileen. From three
hmm,
days, I feel supply has changed, that is decreased,
hmm,
because baby is getting too fussy at breast. I'm switching side 6 to 8 times. When I check with just pressing a breast, I used to get milk, but now it is not happening. While pumping, when I used to get around 120 to 150 ml, now when I pump at same time around 3 a.m., I am only getting around 30 to 40 ml in total. He's 11 weeks old. I am using dual electric pump, pumping for 17 to 20 minutes.
pumping 17 to 20 minutes. How often? In 24 hours?
Uh, how many times she's pumping, you're asking?
Yeah.
Uh,
Is it
that
just once in 24 hours she's
I
pumping?
guess,
Is she saying that?
yeah,
Because she
yeah,
said
I think
about the same time.
same
Okay.
time, yes. When I pump at same time around 3 a.m., so she's mentioning that.
Okay, okay. Yeah, so see, your baby is at the verge of, he or she is around the age of a growth spurt. Okay, so all this is happening owing to that. Okay, so don't worry. Okay, it is possible that, the previous day the baby has fed a lot. As you said, you're switching sides 6 to 8 times.
Hmm.
Okay, that is why you would have got less output on the pump, and which is understandable. Okay, if you're doing it once in 24 hours, it's fine. It's okay. So just continue doing that. Keep on as you are switching the sides. Do the same thing when you are breastfeeding. It will settle down in couple of days. Okay, it's not. It's going to be a little bit tedious for you. 2 3 days, maybe this week you can say. But after a week, definitely you will see things again getting back to normal. Okay, if you are breastfeeding like round the clock for your child, there is no way that your supply is going to go down
Right.
unless you have latching issues. And if you and that would that would be visible if you are having pain or you're having soreness while breastfeeding, which I don't think you have. So don't worry, just stay calm and wait for the time to pass.
Okay. She says thank you so much.
Welcome.
Yeah.
Yeah,
So
I
are we
guess
taking one more question or
I think we have a lot of questions which we have not been able to answer. Okay, I think we can take them up in the comments only, Vidya,
yeah.
because
Yeah,
there are just too many questions. Okay, maybe
I
we can
think we
end
should
the
have,
session.
I think we should have scheduled it for an hour, I think so now when I'm seeing the
the
questions.
yeah,
We
no, the
will not be able to
Instagram will
finish it, Aline,
yeah.
even then, actually.
Yeah, I
Yeah,
know.
Yeah.
because the questions are a lot.
No, 45 questions means how much you have to. It is not possible to go, finish it in an hour also. But before we end, Eileen, I have a question, okay? I like just to summarize the whole thing on low milk supply. There are many instances where the babies are given top feed in at the hospital itself immediately after
Hmm,
birth. So
correct.
what mothers think they have to continue that, else it is not enough for the babies, and they because it is started like that. Many mothers tend to think that if the baby is not taking, maybe I have to top feed because the baby was fine in the hospital. So how do you suggest and end conclusion for this?
Uh, yeah. So, yeah, as you said, Vidya, it is, an unfortunate thing that this happens in the hospital that
Yeah,
baby, instead of giving her to the mother, the baby is given formula. While it can be genuine in some cases, it is not always the case. Okay.
yeah,
So, the best thing I can suggest here, and that too on a platform like yours, is that the best thing to do is just educate yourself. Okay. When you are pregnant, you should read up about breastfeeding. It is very important, and it is not something that will easily come to you. It may come to some of you, but not to most women. Okay, so don't take that as lightly. Please read up about breastfeeding, join support groups, take courses, and educate yourself. Talk to people who are around you who are new mothers, like who have become mothers recently in the last
right.
1 2 years,
Mm,
who can share their experiences with you. And other than that, talking about in the hospital scenario when your baby is offered formula, so what do you do next after going home? First thing you need to do is in the hospital itself, insist for getting your latch assessed by a lactation professional. These days, most hospitals have an in-house LC. Okay,
mm-hmm,
so if they don't have, insist before your delivery that I want this.
mm,
Okay, if that's not possible, you can't, and you feel that your latch, in spite of all the information you have, your latch is not happening, or you're physically not fit to attempt the latch. So then go home, continue the formula, and side by side work on your latch.
right.
Okay,
Mm,
don't just stop formula and try to latch. It will make things worse for you as well as for the baby. Okay, so,
okay.
and whenever you are stopping formula, as I said, even if it is 30 ml formula, you have to wean out step by step. You cannot stop just immediately. So once formula aa gaya, at least next 10 days tak it's going to be there. Assuming that you'll rectify your latch in 10 days, it is going to be there.
Right.
And it's okay.
Mm-hmm.
It's fine. Don't be guilty or don't feel bad about it. Why did this happen to me? I had decided that I'm going to breastfeed my child. It's fine. It is formula, and you are doing every possible step to get out of it and get your child to the breast.
Right.
So applaud yourself for that and do the needful. That's all.
Thank you so much, Aline.
Thank
I
you.
just want to add a few things over here. So everyone who's watching this video now and who will be watching it later on, please remember that it is your baby, it is your wish, it is your decision. Nobody can actually force you to do something that you do not want to do. If you
Correct.
wish to feed your baby formula, then you will do it. If you wish to exclusively breastfeed your baby, then you can do it as well. Okay. So you have to be very clear about what your wishes and what you want to do, and you have to be clear about all these things with the hospital staff. Okay, because it's
Right.
not like you will be meeting them
Correct.
for the first time at the time of your childbirth. you will obviously have a lot of meetups and appointments with the hospital people even before your baby is born. So make it clear, have a plan for yourself in place. But before doing all this, educate yourself so that you take the right decisions, you make the right plan for yourself. Okay, there's no point
Right.
in having the wrong plan. So in order to do that, it is extremely important that you educate yourself with the right knowledge. Okay, and then make things clear. Your partner is with you, or there's somebody else at the time of childbirth with you, maybe your
Yes,
mother, maybe your sister. So make it clear to those
definitely.
people who are helping you out during that time that this is what you exactly want to do with your baby. You do not wish your baby to have a formula milk or whatever, any other wish that you have. But then keep an open mind. Okay, you can plan things, but then you have to be flexible enough. You need to be having an open mind, because everything can't be predicted. There can be situations where things can go in a different direction, not what you intended, but something completely different. So during that time, you need to have an open mind. Otherwise, it gets really difficult. Okay, so have that flexibility in you to adapt to the changes that may happen during childbirth. But then it's really important to communicate your wishes.
Right.
Yeah.
Definitely, definitely.
Yeah.
Yes.
Thank you so much,
Thank
Aline.
you
It
so
was a
much.
lovely
Yeah.
session. And
Thank you, both of you.
yeah,
Thank you so much for calling me for this. Thanks a lot.
yeah, it's
No,
an
it,
amazing idea,
so,
Vidya, to just have a question and answer session. It was
yeah.
we received so many questions, and we still
Really,
are having
I
lots
am
of questions coming in.
actually, actually, this is leading me to think that there are so many mothers who are, going through this low milk supply thing, Matlab, it might not even be an issue for them and they are going through it. So, I mean, this is actually something which we need to talk more about.
Yeah.
Yeah.
And we'll be posting all those questions in the comment section, Eileen. Whenever
Yeah,
you can, please, you can, answer to them.
definitely.
Yeah.
Yeah,
Definitely.
another thing,
Yeah.
I'm just repeating it for the last time in this session. Everyone who have posted their questions in the comments, we cannot get to your questions because they will be lost as soon as the live session is over. Please post your comments either in the question box or else post it on the comment after we share the live session on the feed. Okay,
Yes.
so everyone who have posted their questions in the comments, I'm so sorry, we will not be able to answer them.
Yeah.
Yeah, that's
All
it
And
right.
from my
yes. And
yeah.
thank you once again, Eileen, for joining us.
Welcome, yaar. And thanks to you all also.
Thank
Any time
you.
for you guys. Anytime.
Oh,
Chalo.
that's so nice. Yeah. Thank you, everyone, for
Thank you.
joining us, and we'll be watching. Bye. Take care.
Bye. Take care.
Thank you. Bye bye.
Bye.
Bye.